Hi, I'm Dr. Ken Pinnell, your Cranberry Township, North Pittsburgh Chiropractor. Today I would like to go over some exercises that we recommend for people that have shoulder pain. Now when we talk about shoulder pain in this instance, we're talking about the shoulder joint, which is made up of the long bone in the upper arm called the humerus, the clavicle, which we call the collarbone, and then there's a bone in the back called the scapula, the wing bone. Those three bones form up what we call the shoulder joint. Some of the patients that we see, sometimes they'll come in and they'll say, my shoulder hurts, and they're pointing more to their neck or to a muscle in their back called the trapezius muscle. But these exercises are specifically for the shoulder joint. And some of the problems that these exercises would help with would be things like a sprain or a strained shoulder where muscles have been injured and now you want to strengthen. If there's some range of motion issues with the shoulder, these exercises are real helpful. Also be helpful for problems like tendonitis or bursitis and even a mild rotator cuff issue. If a rotator cuff is torn, you probably wouldn't want to do these, but if you have a partial tear or you've injured but not torn the rotator cuff, these exercises specifically would be very helpful. Now the one thing that you will need to do these exercises are some resistance type apparatus, either resistance tubing or this type of device here. These are things that some people might have laying around from if they've done some physical therapy, but you could find these certainly in a drugstore or home health care. Even Walmart might carry these. Certainly you could order them online on a place like eBay or Amazon, but you'll need some type of resistance banding or tubing to perform these exercises. Now, two of the primary motions in the shoulder and those that would involve the rotator cuff are what we call flexion, which would be raising the arm this way, and abduction. Abduct means to take away, so abducting the arm would be coming up this way. So the way we would do those two movements in exercise is you can just get this resistance tubing and just step on it with your foot. And then for these two, you want to have the thumb pointing up. And you want to come up in a nice slow motion. And then you want to also resist going back down. And that creates two different contractions in the muscle, what is called a concentric contraction going up and an eccentric contraction going down. Without getting too technical, each one of this has their own specific benefits. So you want to start nice slow motion coming up, nice slow motion going down, and you want to try to do 10 to 12 repetitions of flexion up and down. Now for abduction, you would come out to the side and you would do the same thing. You just come up, slow, resist going down, up slow, resist going down. In each of those exercises, the muscles responsible for flexion and abduction. Now to isolate what's called the supraspinatus muscle, which is one of the primary muscles of the rotator cuff, you would, if this is 0, out here is 90 degrees, you'd want to come to about 45 degrees, halfway between straight out to the front and straight out to the side. In this one, you want the thumb pointing down. And whereas with flexion and abduction with the thumb up and coming up as high as you can, with the thumb down, for this particular exercise, you don't want to go above shoulder level. That will put too much strain and stress on that supraspinatus muscle. And if there's an issue there, that might tend to hurt rather than help. So you want to come up just to about 90 degrees, not above shoulder level. And same thing, slow up, resist going back down. And you want to do about 10 to 12 repetitions of that also. Now the next two exercises we're going to show are for what we call external and internal rotation. Okay, now for the internal and external rotation exercises, what you need to do here is to make sure, some of these come with a handle on the end, that we just have a piece of the resistance tubing here. If you tie a couple knots in the end, you need something to either secure it on a doorknob, or in this case, what I do is just put that knot on the other side of the doorway and close it, and that would anchor that tubing on one end. You just want to make sure the door is closed and that's properly secured, because if you tug on this and that door is not open, this is going to fly out. Now, the other thing we recommend for these two exercises is a towel would work, a small pillow, and you want to put that underneath the arm here, and you want to kind of keep that arm up against the body to a degree. And what that helps to do is just kind of secure the arm and isolate the movement here into external and internal rotation. If you don't have that there, sometimes that elbow will move around and it kind of decreases the effectiveness of this particular exercise. So for external rotation, you would just pull the arm out this way, and the same thing, you want to do slow out, and you want to resist coming back in. If you have too much slack, you're not going to be as effective here, so you want to make sure that you have constant resistance, both going out and then also back in. And you want to do that about 10 to 12 repetitions for that. Now the other, we're going to demonstrate on the other arm for internal rotation. You would do just the opposite. You would start out this way and pull in towards the body. So you want to start out here, internally rotate that shoulder, slow coming in and slow going back out. Now, needless to say, if you're concerned about whether or not you're capable of doing these exercises, certainly seek the advice of a qualified chiropractor or medical doctor. If you get to a certain repetition and you're starting to feel pain, don't push that. If you only get to repetition 3 or 4, that's okay. Try to build up to that 10 or 12, but you don't want to push it. So if you have any questions or comments, feel free to leave that below. You can find us on the web at www.pinnellcc.com or on Facebook or YouTube. If you'd like to see us do a video on a particular subject, feel free to leave a comment. For now, this is Dr. Ken Pinnell coming to you from Pittsburgh Chiropractic. You are Cranberry Township, North Pittsburgh Chiropractor. Hope to talk to you soon. Thanks.